Hello parents, I am Dr. Deepak Gandhi, working as a pediatrician in Dubai. Let's discuss about diarrhea and children. There are many questions which parents want to know about. Let's discuss what is diarrhea, what is not diarrhea, why a child has diarrhea, what kind of food I can give to my child in diarrhea, what kind of fluid I can give, whether my child will need antibiotics or not, how should I ensure that my child should not become weak, and whenever child develops diarrhea again and again, what should I do? So, there are many questions. Let's discuss all these questions in detail so that you do not have trouble while handling the diarrhea for your child. So, the first question is, how do I suspect that my child is having diarrhea? When the stool is unusually loose or watery and occurs at least 3 times within 24 hours, we can call it diarrhea. It depends on the recent change in consistency of the stool and frequency of the stool. Because if a newborn baby who is feeding and passing stool after each feed, it may not be a diarrhea even. Normal child or a normal person passes 1 to 3 stools which are formed and soft, and they pass it without any difficulty. So, we don't call it a diarrhea. It is a stool frequency for anyone. So, the first questions parents ask me, why does my child have diarrhea? Diarrhea can occur due to many reasons. Most common of them are viruses. And out of all viruses, rotavirus is the most common VAN, which affects the children of younger age, especially less than 2 years of age. And a matter of fact, apart from this, there are other few reasons, like bacteria, parasites, reactions to medicines, food, allergy, intolerance to food substances, or few other disorders of the intestine, which can cause diarrhea in your child, and the organ which is affected by the diarrheais, the gut. So, the route of entry is oral cavity or mouth. So, the diarrhea usually develops in the setting of poor and hygiene. Whenever there is a lack of safe drinking water, improper hand hygiene while preparing the food, or handling the food, or handling the child, or leaving the cooked food uncovered, using the utensils which are not clean, bottle feeding, consumption of unpasteurized milk or unhygienic street food, improper disposal of excreta. All these are the common reasons for diarrhea. Parents, be alarmed. Even after taking all the hygienic precautions, your child still can get diarrhea because there are so many other reasons, like viral infections, which come through the air and you cannot control them. So, the next question comes, what kind of food or fluid I should give to my child when he or she is having a diarrhea? Your child has a diarrhea means he is losing water and electrolytes in the stool. So, the first thing to cover is electrolytes and water. So ORS, oral Rhydration Salt, is the best to recover from it. Apart from the ORS, you can give zinc, which is the recommended medicine for the child in diarrhea. And all other medicines, including antibiotics, are not routinely recommended, so you should avoid them until it has been given by your doctor, after thorough examination and the tests if needed. So, what are the other foods a child should get when child is having a diarrhea? Apart from ORS, breastfeeding should be continued if your child is already on breastfeeding. Rice or pulses, vegetable soup, yogurt, drinks like salted lassi. Lemon drink means we call it shikanji in India, with added salt and less sugar. Coconut water. Plain water can be given in between. And now, what are the dangerous signs when a father or a mother should be alarmed? Reduce frequency of urine, feeling very thirsty or lethargic, not responding to your command, looking quite ill, vomiting everything, there is a blood in the stool, severe stomach pain, very high fever, inability to drink or eat anything, cold extremities. These are the dangerous signs. If you find any of these, please go to emergency. Talk to your doctor immediately. Now, one of the most important questions is whether a child will need antibiotics to recover from the diarrhea. No. Most of the diarrheas, they get corrected by itself within 3 to 7 days. So even if there is a bacterial infection, most common which of them is E. coli even, that gets corrected or gets treated by itself by the body. So, in most of episodes we don't need antibiotics, but there are certain cases when we need antibiotics, especially when there is an other concomitant infection like ear infection, urine infection or pneumonia. So these will require diagnosis with the help of a doctor and antibiotics. Or there is a pus in stool. Your doctor may advise antibiotics after the test. So, How parents can help their child to recover from the diarrhea faster. To help the child digest food more easily, meals should be given more frequently in the smaller quantities. This will also reduce the chances of vomiting. Breastfeeding, if it is going on, should be continued and should be offered more frequently. Foods such as gruels from the rice, pulses, other cereals which are readily available in your kitchen should be used apart from the breastfeeding. And after each episode of diarrhea, child is losing water. So, make sure you increase the intake of other liquid items, if it is possible, and the plain water can be given in between frequently. And once the diarrheal episode is over for the next 1 or 2 weeks, try to give food little extra to recover from the weakness and to regain the weight of the child has lost during this episode. Many parents, they complain that my child develops diarrhea every now and then. What can be done for that? So, there are a few points you can take care of about one of them. And the most important is care of nutrition. A child's nutrition is the most important for his immunity. It's because good nutrition is a very crucial factor for preventing any recurrent infection in any child. To make sure that a child gets proper nutrition, it is important for the first 6 months of life to continue breastfeeding. And after breastfeeding, start complementary food prepared at home. Complete the course of the zinc for 14 days. For the next 3 months, you do not have to repeat the course of zinc even if the child gets diarrhea. Please take care of personal and take care of food hygiene. Wash your hands before and after handing the food. Before and after handing the diaper of the baby, and whenever you handle anything which you feel you are not sure about whether it's clean or not. Use safe drinking water. Prepare the food in hygienic conditions and cover the food once you have used it. Do not allow your child to swim in unclean pools. Use the toilets and avoid open defecation. Make sure to give vaccinations, especially for rotavirus and measles, as they help in preventing diarrhea. Avoid self-medication. And there are certain diseases like food allergies and inflammatory bowel diseases. In such cases, you have to go to your doctor for the advice. Many parents ask, what are the food items they should avoid when the child is having diarrhea, or which they should avoid in routine so that the child doesn't have diarrhea? So, the foods to be avoided are high-sugar foods like cold drinks, juices, even tea, coffee. Other carbonated drinks should be avoided. Avoid giving street foods because they have poor hygienic conditions where they are prepared. Chances of parasitic infections are much more common in such cases. Similarly, processed foods should be avoided which are reheated or treated with the salt excessively. One of the important questions parents ask me very frequently: should I stop giving milk to my child because the other doctor told me to stop giving milk? No. Usually we don't have to stop the milk for any child. If your child is on breastfeeding, we advise to continue it and try to give it more frequently, because this is the food which your child can digest very easily. But yes, in few cases when the diarrhea persists beyond 10 to 14 days, or the frequency is too much, or there is a redness around the perianal area which is increasing and not going down, your doctor may advise you to cut down the milk for few days, and it is temporary and it's never permanent. I hope these things will help you to understand diarrhea better. Treat your child better in diarrhea and to avoid unnecessary medicines while your child is having diarrhea, and it will help you to prevent the diarrheal episodes in your future for your child. Wishing you again happy parenting. Take care.